Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease. Through plain language interviews with experts, we will offer actual knowledge so you can thrive today. My name is Eileen.
My name is Cheryl.
Join us as we bust myths
and spotlight evidence. So today we're so excited to have an expert here, Dr. Liew, who's going to be talking about axial spondyloarthritis, which includes ankylosing spondylitis and non-radiographic axial spondyloarthritis.
Can you walk us through what is this condition?
Yeah, so it is like a cousin of rheumatoid arthritis. It is where the body's immune system is causing inflammation, and we typically think about it as being in the spine. So there's inflammation in the spine, which is what the word spondyloarthritis means, and that is the more general term. And people may hear of different terms or different diagnoses that all fall under this. So ankylosing spondylitis is an older term that is being less used now. That is one diagnosis. And then we have more complicated diagnoses like non-radiographic or radiographic axial spondyloarthritis that we can talk a little bit more about. But they all refer to having inflammation affecting the spine. But I would note that people could have inflammation in other parts of their bodies, including the joints, but also just other parts of the bodies that are not joints.
Thank you so much. That's really, really helpful. I'd also like to know next, can you let us know a little bit about your training and how you came to specialize in this research?
I think my training journey and how I got here has to do with the fact that before I started medical school, I had a close friend tell me that they were diagnosed with ankylosing spondylitis, and they recommended that I look into becoming a rheumatologist. So this was approximately January 2009. I wrote it down on a piece of paper, as I do with everything important to me. I did not know what a rheumatologist was. I did not know what anything was, but I was like, okay, I'll consider this. And then I started medical school in 2010. And then pretty soon I connected with a rheumatologist who was both a really strong patient advocate, who was just an excellent clinician, who also enjoyed teaching. So that was just a great connection. In medical school, I went on to shadow him even after he moved cities. And that really led me into really deciding I wanted to do rheumatology. So after completing medical school, which was 4 years, I started a residency in internal medicine, which you have to do before you become an independent clinician, like practicing on your own as a doctor. And during that time, I really solidified my desire to go into rheumatology as an advanced field, which required more training after that, but as well as go into rheumatology research so that I can really advance our understanding of why different things are. So who's at higher risk for different outcomes, or how the treatments really work after they're studied in clinical trials. So multiple years of training later, I'm at Boston University, and I'm seeing patients as a rheumatologist, and I'm doing clinical research, trying to get better answers that I can provide for the patients that I see.
That's amazing. Thank you so much. We know you're very busy, very prolific researcher and science communicator on Blue Sky. So I'll go ahead and let Eileen start with the first myth that we're going to have you bust.
Yeah, so I've been watching it for a while and know that you're an absolute rock star in the rheumatology field. So thank you for joining us today. It's an absolute honor to get to interview you and also understand a little bit of your personal journey to becoming a rheumatologist. I have a little personal journey myself to ankylosing spondyloarthritis because I might have it. And I'm going through the old scene if I have another form of autoimmune arthritis. So very interesting. And one reason why I love this myth: only white men get axial spondyloarthritis. If I'm diagnosed, obviously that busts that. But what's your evidence behind that?
So the reason a lot of the myths that we're going to talk about today have to do with how medical training happens. They say when you're in medical school, you're drinking from a fire hose of information, and you're supposed to learn all these intricate details about all these diseases, how to diagnose them, how to treat them. And you're never going to actually carry out all of that yourself, because when people are generalists, like general practitioners or primary care doctors, they're not going to be treating people with cancer with chemotherapy, for example. They're not going to be diagnosing people with different rheumatic conditions, most likely, but they're supposed to recognize that person might have that condition and refer appropriately, like to a rheumatologist. So medicine has just gotten so specialized, and there's so much information that we now know. But the only way for medical school in 4 years to cover all of the information and get people to at least try to recognize when someone needs to see a rheumatologist for possible axial spondyloarthritis is to give them what we call buzzwords. And they do that by asking lots of questions where it's a scenario of you have this patient in clinic and they have these specific symptoms. And oftentimes it's a very stereotyped picture of what it would be. And the traditional description of ankylosing spondylitis is a young man about 25 years old, say, who has low back pain, and usually they are white, and usually they are HLA-B27 positive, and they might throw in some other symptoms that are associated, like they might have a really red, painful eye with blurry vision. That's called uveitis. It can occur in some people with ankylosing spondylitis, and so on and so forth. So medical students are taught to recognize this pattern, but it misses a lot of people who definitely do have this condition.
That's such a fascinating insight into what you're learning as a medical student, as a resident, when you're just, like you said, drinking from that fire hose. So I'm glad you were able to bust that myth that it's definitely not only men and not only white men that get axial spondyloarthritis. The second myth is that axial spondyloarthritis is easy to diagnose. Is that true or false? Why or why not?
Right. So if you match that like stereotypical case, then it is easy to diagnose. If someone is a young white man with black back pain that is better when they're exercising, worse when they're trying to rest or sleep, they're HLA B27 positive on this blood test. And when you do an x-ray and you look at their pelvis hip area and you see that their SI or sacroiliac joints in the pelvis, they have joined or fused together, which is what ankylosis means, bony fusion of bones, then yes, that is an extremely easy diagnosis to make. But that is a small subset of all the people who have axial spondyloarthritis. So again, it's not even uncommon in a woman or someone who's not white. It may be less frequent than in someone who is a white male, but it occurs in everybody. And the x-rays, which we'll talk about later, I think in a different myth, that just represents a subset of people who have this condition. So in the people who have those features, easy to diagnose, and everyone else very difficult.
Yeah, and just to tag along with that before we go to the next one, can you share a little bit about your research into like social determinants and how like how people in different social categories experience delays in diagnosis?
Right. So tied with the fact that axial spondyloarthritis is overall not easy to diagnose, this is a condition that has a really long delay to diagnosis. So the time from your symptoms starting until the day that the doctor gives you that diagnosis and talks to you about treatment, it can be many years. Some studies say like 8 years more than that. And that's not improved despite having more medications to treat this condition, more like imaging like MRI to try to diagnose this condition better. And that's just an overall number. And our question was by different groups of race or ethnicity or social economic status, would there be even like longer delays as compared to a population that might be white or white and male and young for reference? And we did do a study looking at just our hospital, and we did find that factors like having documented social needs like housing instability or food insecurity, that was associated with a longer time to diagnosis axial spondyloarthritis. In different race categories compared to white race had a longer time to diagnosis, counting from the first time they had seen a doctor about some symptom like back pain that was probably related to their diagnosis.
It's
Yeah.
very eye-opening, and I met having taken a very long time just to get my rheumatoid arthritis diagnosis. I can only imagine how difficult it is for people who don't fit the box for a diagnosis that has a myth like only white men get axial spondyloarthritis around it. Now, there is another myth about axial spondyloarthritis that might make diagnosing it a little bit easier or maybe a little bit harder. A positive HLA-B27 test means you have axial spondyloarthritis. Is this a fact or is this a myth?
Right. So this is a really complicated one to explain. And HLA-B27 is a gene variant, and it's a gene that relates to a protein that's involved in like cell function and the immune system. Being positive for this gene variant, HLA-B27, is strongly associated with having ankylosing spondylitis, which is a form of axial spondyloarthritis. But less than perhaps 50% of the overall genetic risk for ankylosing spondylitis is due to this HLA-B27. And genetic risk is only part of the package because even if you have family members who have this condition, although you are higher risk for the condition compared to someone with no family members with this condition, you're not going to 100% automatically get it because your father had it, for example. And there are lots of people who are carriers of this gene variant who will have a positive HLA-B27 blood test who will not develop AS, ankylosing spondylitis. And it's really only a minority of people who have that blood test positive, if you tested everybody, who will develop ankylosing spondylitis. So by no means is it a test that equals having ankylosing spondylitis.
Thank you so much for explaining that. That's definitely a myth that I've heard before. And it really is, my heart goes out to everyone listening who maybe is in that, what I call diagnostic purgatory, where you just don't know what you have. You just know it's something that is causing you pain, and just know that, it's complicated for everyone, right? The doctors too. And so empathy all around. Similarly, I think I actually thought this myth for a while that axial spondyloarthritis always shows up on imaging. Like you can definitely see it. Is that a myth or is that a fact? And why?
Yeah, so this gets complicated. I like that you said imaging, but for a long time, it was just x-rays. You just had the x-rays to focus in on the SI or sacroiliac joints and pelvis, because that's the classic sign that if the x-ray shows that those joints are fused or ankylosed together, that is diagnostic for ankylosing spondylitis. But x-rays only capture some of what's going on. So the ankylosis is a reflection of prior damage. The bone has already done this thing where it's fused this joint together. So the joints are supposed to move. And when they're fused together, that's not good. And this is something that can also happen along the rest of the spine as well, causing people to have what is called the bamboo spine, where every vertebra and the spine is fused together. But there is a lot of inflammation that happens that if it doesn't cause this bone or joint change or damage, you wouldn't see it on an x-ray. So there are a lot of people who have lots of inflammation that you might see on an MRI of the same place of the sacroiliac joints, SI joints, who will have completely normal x-rays of the same place. So it was a huge revolution of imaging to have MRIs and to identify which MRIs were actually indicative of or just more consistent with this diagnosis, because people are getting normal x-rays and being told they didn't have this condition at all. And now we know that non-radiographic axial spondyloarthritis, which really means they have a positive MRI showing inflammation and or damage to the bones and joints, but have a normal x-ray. Now we know that this is a whole subset of people that we were missing with just x-rays alone.
Thank you so much. And that's a great example of how science, changes over time. And hopefully we keep getting better and better diagnostic measures. Oh, I'll hand it over to Eileen now.
Yeah. And first, you have taught us so much already in such a short amount of time and in excellent plain language, may I add. Now, our last wrap up question, a little bit of a conclusion. In one sentence, what is the most important takeaway you'd like someone to learn from this episode?
I think the most important takeaway would be if you are concerned about having axial spondyloarthritis, that it is not a bad idea to look on the internet for trusted resources to better understand what you should be looking for.
Well, that dovetails perfectly into my question, which is where, if people want to either connect with you or learn more about axial spondyloarthritis, I guess those are two different questions, where do you recommend they go?
Well, this is a very US centric recommendation, but the patient organization for spondyloarthritis in the US is called the Spondylitis Association of America, SAA. They have a lot of information as well as just like handout information, videos. They have like webinars and global summits with videos from experts like me and my colleagues that they have posted on their website. And they also have just information about how people can like have local meetups with people who are living close to them so they can have like peer support in person as well as online. I know that the UK has its own version. I know Canada has its own version. Different countries have their own versions of this, but you want to be looking for a patient organization around that disease condition, and that is where you would find relevant information. You're not looking for like Google's AI like generated information about what's the condition. Don't look at that. Go look for a patient organization that's for patients and has connections with experts.
Absolutely agree. Now, thank you so much for joining us today and walking us through the difficult to understand process of diagnosing axial spondyloarthritis. And thank you to our listeners for joining us today. Stay tuned as we uncover more myths, stigmas, and misconceptions about rheumatic diseases.
Thanks so much. Bye bye for now.
Thank
Bye.
you.
Thanks again, Dr. Liew. Bye.